Today we're talking about Lyme disease testing and what it takes to get a diagnosis so that you can get the proper treatment for Lyme disease. And as you're going to see, there's some serious issues with the testing procedures and the type of tests that they use. So we're going to talk all about it today. Let's do it. Okay, so this is the realities that come with Lyme disease testing and diagnosis, okay? So first of all, this is the CDC website. We're going to look into what they say about diagnosis and testing. When assessing a patient for Lyme disease, healthcare providers should consider the signs and symptoms of Lyme disease. That basically means look for the EM rash before anything else, the erythema migrans rash, the big bullseye rash that Lyme disease is famous for. If they have that, you basically skip all of the testing and they just say you are diagnosed with Lyme disease. So if you do not have that, that is when the problems start to happen. So you also want to take into account the likelihood that the patient has been exposed to infected ticks, the possibility that other illnesses may cause similar symptoms such as fibromyalgia and certain sleep disorders. So when it comes to lab testing, it says that the CDC currently recommends a two-step testing process. Both steps are required, and if the first step is negative, no further testing is recommended. If the first step is positive, then the second step should be performed, and the overall result is positive only when the first test is positive and the second test is positive. Okay, but here's the thing to remember, and it even says key points to remember. This is the CDC website, and they say most Lyme disease tests are designed to detect antibodies made by the body in response to infection. Antibodies can take several weeks to develop, so patients may test negative if infected only recently. So if you get bit by a tick today and go get a test today, you're not going to get an accurate result. Antibodies normally persist in the blood for months or even years after the infection is gone. Months or years, guys. This is serious stuff. Therefore, the test cannot be used to determine cure. That means once you have Lyme disease, there is no test that can say, okay, you are cured from Lyme disease. Infection with other diseases, including some tick-borne diseases or some viral, bacterial, or autoimmune diseases, probably as well as mold toxicity, can result in false positive test results. Okay, some tests give results for two types of antibody, IgM and IgG. Positive IgM results should be disregarded if the patient has been ill for more than 30 days. Okay, so as you can see, there's some serious problems with testing. If we're only testing for the antibodies, then basically anybody can have these antibodies in their body as long as they have some kind of infection, some kind of tick-borne disease, viral, bacterial, that covers pretty much everything, or autoimmune diseases, right? I mean, this is just kind of a joke. Basically, they're just measuring the amount of IgM and IgG antibodies in the body and then determining whether or not you have Lyme disease based on that. So it is completely inaccurate. And some of the data that I've read says that it's about 50% accurate. That means it's just like the flip of a coin, whether or not you have Lyme disease based on these testing procedures. Now, why is this a problem? Well, if you can't get a diagnosis for Lyme disease, then you can't get the proper treatment. You won't be able to get, any antibiotics or anything that can help you get rid of that infection. And also, even if you do get the diagnosis, the CDC does not consider chronic Lyme disease to be a real disease, and it causes serious issues for those of us that have long-lasting symptoms beyond original infection. This is a serious problem, and as you can see, the CDC supports the development of new tests. This is basically saying, somebody please create a better test that can tell us whether or not people have Lyme disease that doesn't depend on antibodies, because if you can do that, then you can actually solve the problem here. So as you can see, it can be difficult to get the proper diagnosis. The tests are not very accurate, and it really is left up in the air as they're searching for more and better ways to do the testing so that more people can be diagnosed with the correct disease, so that more people can get the correct treatment and get rid of that said disease. And that doesn't even take into account the fact that they don't recognize chronic Lyme disease as a real disease. They call it post-treatment Lyme disease syndrome, which just means you have symptoms after the treatment for Lyme disease, right? Which means, okay, the treatment did not work. Now what do we do? and they don't even recognize it as a real thing. They just call it post-treatment Lyme disease syndrome. And it can be a serious problem when it comes to getting covered by health insurance, when it comes to, finding the proper treatments, the things that are actually going to help heal your body, and the ability to get help with Lyme disease. These are all serious issues. We go over them regularly. So make sure you hit the subscribe button below this video so you can stay up to date on the latest and greatest and recover from Lyme disease.